Welcome back, podcast fans. I'm your host, Annette Hines, and this is Parenting Impossible, the Special Needs Survival Podcast. Today, I have a not very pleasant topic to discuss with you, and it's all about a recent murder that happened in New York of Brian Thompson, who was the former CEO of UnitedHealthcare. He was the current CEO when he died. This is just a topic that comes up over and over again in all different circles that I am in. Having experienced it personally, having had a disabled and chronically ill child who was very expensive medically to care for. I have been watching the rise of frustration in our country and around the world for healthcare insurance companies and the people they are supposed to serve. So let me tell you what started off this podcast for me today. I saw on X, formerly Twitter, which I keep saying, by the way, that I am going to get off of because it is so full of screeching people who sometimes just sound insane, honestly. But I happened to be scrolling through my social media, which I do often on the weekends, and saw this quote. When you shoot one man in the street, it's murder. When you kill thousands of people in hospitals by taking away their ability to get treatment, you're an entrepreneur. So I had goosebumps when I read that, because, I've been through this personally. I know so many people, friends, family members, and so many clients over the last few decades that have just had to fight, scratch, and claw to get coverage for very necessary treatment for themselves or their disabled or chronically ill loved one that they are a caregiver for. So let me tell you what happened. I got most of this information from the New York Times and several other sources. So apparently on Wednesday morning, December 4th, Brian Thompson, who was the CEO of UnitedHealthcare, was fatally shot and killed outside a Midtown Manhattan hotel. The bullet casings at the scene had these three words etched onto them: delay, deny, depose. So there's a speculation, and the New York Times is reporting that they may have been related to a 2010 book called Delay, Deny, Defend. And this book was all about how health insurance companies avoid paying claims. So 14 years ago. And I just wanted to give you a couple of facts that came out from that article and from other sources, reliable sources. So last year, Brian Thompson earned $10.2 million. Okay, only $1 million of that was his base pay, which already is just huge. I mean, most of us can't even imagine earning $1 million in a year. But $9+ million of his compensation was basically cash and stock grants based on profitability of the company. So let's talk about UnitedHealthcare profitability. From 2021 to 2023, UnitedHealthcare profits rose. Now, this is not revenue. This is after expense profits, okay? Rose from $12 billion to $16 billion. And because of that, Brian Thompson earned an additional $9 million in compensation. Now, many of you will say, well, that's our entrepreneurial system. A lot of people benefit from having UnitedHealthcare stock in their portfolios and their retirement plans and so forth. All true. I am not passing judgment. I am just throwing out some food for thought and some, just some facts to contemplate. So UnitedHealthcare has grown so much that they had been at the time being investigated on multiple fronts. And, one of the things that I'm thinking, and I've been contemplating, and I don't have an answer yet, is since Mr. Thompson owned about $20 million in shares of the company in the third quarter of last year, of this year, isn't it a conflict of interest for him to be profit driven? And the profit driven approach, it really is in conflict with a patient-centered approach, which is really oriented in healthy outcomes for patients. You can't always be thinking about cost cutting and driving profits up when you also need to be thinking about healthy outcomes. When you are forced to make decisions about care based on profitability, the patient is going to lose at least some of the time. So at the time, UnitedHealthcare was being investigated by the Department of Justice on antitrust claims. What is an antitrust claim? That is where a company gets to be so big, merging with other companies or just in growth, that they are controlling the market. And UnitedHealthcare has come under fire from the Department of Justice on this issue. In addition to that, there was a Senate panel reviewing and reporting on UnitedHealthcare's private Medicare Advantage plans. And that included an increase in post-acute care denials, so people coming out of the hospital, which increased in a 2-year period from 2020 to 2022 up from 10.9% in 2020 to 22.7% in 2022. So denials in a 2-year period doubled at the same time that the profit was going through the roof, and CEO and probably others' compensation was also increasing based on these profit margins. So what does this all mean? I think you can see the frustration level that many people in our country who are disabled or chronically ill have with their health insurance providers, whether it's public health insurance like Medicaid or Medicare, or private health insurance like Blue Cross, UnitedHealthcare, Tufts, whatever you have in your area. Of course, we can't condone violence. Of course, that's not the place to fight this battle, right? But when you have to claw and scratch and fight for every benefit that your health insurance policy is supposed to give to you, when you have to be your own advocate, and when it's so difficult to understand those health insurance contracts and what you're entitled to and what you're not entitled to, and when you don't have a lot of options for purchasing health insurance, it's not a healthy market. It's not, as the Department of Justice is worrying about this, the cost of insurance continues to rise I'm going to say ridiculously, as someone who has to buy their own health insurance can say. And every year it covers less and less, and my contribution goes up and up. What is the answer? What is the answer? I don't know, but I'm just throwing this out there for a discussion point. I can't imagine a different system. So for example, are we still the best system in the world, or are there other alternatives? And many people will point to Canada or England as an example of, a guarantee healthcare, guarantee from your government healthcare. But are those the best systems? I don't know. Reports have been coming out of England for some time now, some years now, where people are dying because it has been determined to be too expensive to continue to care for them. And obviously, this greatly impacts people who are chronically ill or disabled. In Canada, there's been a rise of assisted suicide for people who are chronically ill or people with disabilities. And that this has been reported. There was a change in the system for allowing these compassionate assisted suicide cases. And people are definitely speculating. I speculate that the cost of care may be driving this policy change in Canada. Many people in Canada who have means will come to the US and privately pay for healthcare and treatment that they cannot get from their public system in Canada. All food for thought. So what is the answer? Well, the answer is not to murder people. The answer is not violence. But if it comes out that the motive behind Brian Thompson's murder, senseless, violent act that it is, what does this mean? It's definitely sparking discussion all over the discussion boards that I'm on regarding, of course, violence is not the answer, but here's what we encounter. Here's what we've been going through. I will just say that in 2013, as my daughter was getting sicker and sicker and needing more and more intervention, and her life was literally winding down, I was in battle with our state Medicaid agency over the number of care hours that she was receiving from nurses. They, just months before she died, the Medicaid agency had proclaimed that she was better and that she didn't need as much care, and citing this measurement tool that they use that measures how many minutes to do this activity and how many minutes to do that activity, rather than looking at her globally and, where her health was and what her overall needs were. And so I was in a battle for an appeal just months before she died, a few short months, not many months. And, I'll never forget this because it was a terrible time. And even though I am an attorney, I hired someone to help me because I was exhausted, didn't have enough coverage, was up, 3-4 nights a week overnight, taking care of her and trying to work the next day, and was not literally in my right mind to be able to defend this appeal for her care, for cost of care and care hours. And we ended up negotiating a settlement of, getting some of the hours back, but not all of them. And after Elizabeth passed, and it was some time after she passed, a month or two, I got a communication from the care person that was connected to the organization that evaluated her care needs and reported to Medicaid in our state, what her needs were. This is like the pre-authorization process. So we had this case manager for a few years, and she, communicated with me how shocked and surprised she was that Elizabeth had died. Yeah, I didn't answer her. Couldn't. Just uh just floors me, And that was, of course, not the only battle we had. We had so many. And frankly, we were in a state where it was better to be. I mean, we had more care than a lot of people that we knew across the country. It was still not enough, though. And I get that Elizabeth was very expensive. I get that there's this battle that goes on between private insurance companies like Blue Cross, who was covering us at the time, and Medicaid or public insurance companies, and that the private companies pass the buck constantly to public companies, which then, are trying to live within budgets, etc. So that's where we're at. I wanted to raise this as a discussion issue. I would love to hear from you in the comments. What do you think about this issue? Not about the murder, but about the rising costs of healthcare and the rising denials of care coverage, as well as the battles that are becoming more and more impossible to wage and win for care that your person is entitled to or that you are entitled to. So please let me know. And thank you so much for listening. If you are new here, I would really appreciate getting to know you a little bit and getting to know what's important to you and, where you feel I can add value in your life and in your journey. I look forward to hearing from you. Thank you. And if you do have a minute, I would so appreciate a rating, 5 stars, please, and a review. Thank you so much.